Hi, my name is Acetaminophen and I'm going to talk about increased phenylephrine plasma levels with administration of acetaminophen. As a definition, we have that phenylephrine is a medication primarily used as a decongestant to dilate the pupil to increase blood pressure and to relieve hemorrhoids. And acetaminophen is an analgesic used to temporarily relieve minor aches and pains due to headache, muscular aches, backache, minor pain of arthritis, the common cold, tooth ache, and premenstrual and menstrual cramps. It is also used to temporarily reduce fever.
Phenylephrine is a pure alpha adrenergic agonist. This means it will have its effects mainly by causing vasoconstriction of our blood vessels. And because of this vasoconstriction, you will see an increase in systemic vascular resistance, and as a result, increases in systemic blood pressure. But because phenylephrine acts primarily on alpha-1 receptors on blood vessels, without any effects on chronotropy and inotropy, it theoretically can cause a reduction in cardiac output. Whether or not this is true in reality is up to debate, but most studies show that cardiac output is either maintained or actually increased in patients without pre-existing cardiac dysfunction. You may see phenylephrine commonly used as a pre-made syringe in things like anesthesia or post-op intubation-induced hypotension. It is also seen in cases of hyperdynamic sepsis and other neurologic disorders causing hypotension. So in summary, phenylephrine's main effects is to cause vasoconstriction, which leads to increases in vascular resistance, and as a result raises systemic blood pressure.
Good morning everyone and welcome back. Today we're going to be talking about acetaminophen, which is sold as Panadol, Tylenol or Vivadol. It works by inhibiting COX centrally. In other words, it inhibits the cyclooxygenase enzyme in the central nervous system, but it has no peripheral action and no anti-inflammatory action. It's mainly used for its antipyretic effect. We use it for children with fever instead of aspirin to avoid Rey syndrome. It also has mild analgesic effect. In exams, they usually ask about the overdose part. If somebody overdosed on acetaminophen, they will produce the metabolite NAPK. NAPK is an oxidizing agent and it's very toxic. Glutathione in the liver detoxifies and breaks down NAPK. However, glutathione is finite and limited, and it can easily be overwhelmed. So eventually glutathione will be depleted and NAPK will toxify the liver. We can treat the overdose by NAC or N-acetylcysteine, which will regenerate glutathione. Try answering this quiz. What liver enzyme metabolizes acetaminophen to produce NAPK? And here's the answer. Alright guys, that's everything I've got. Hopefully I made this easier for you. Thanks a ton for watching, and I'll see you guys later.
Now we have the applications in medicine. Over-the-counter combinations containing acetaminophen and phenylephrine for the treatment of the common cold and influenza are widespread after the substitution of phenylephrine for pseudoephedrine. Phenylephrine is metabolized by sulfation in the intestinal wall. It seems likely to acetaminophen interferes with this process and increases the level phenylephrine with respect to bioavailability.
The best treatment for the flu depends on the individual. If an individual is a fairly healthy, middle-aged person, there is nothing more than fluids and rest that's going to help the individual. Keeping from getting dehydrated is very important. Resting as much as possible. If the symptoms are caught and treated within 48 to 72 hours, that could shorten the course of the influenza. Now, any high-risk individuals, people who have underlying heart and lung disease, those folks should be seen simply because if they have any alarming symptoms, they may need further treatment, further evaluation.
Now that we have the pros and cons, as a pro we have that it is useful as a treatment for the flu, and ibuprofen was subsequently shown not to contribute to this increase. And as a cons, we have that those combinations containing acetaminophen, ibuprofen, and phenylephrine resulting in nearly a quadrupling in the maximum plasma concentration. And side effects can also include insomnia and headache.
So many people have pain, and pain can be helped by medication. But there is no free lunch. Every medication that you take will have some side effects. So let's look at those. Number one, regular old Tylenol. Tylenol is a good pain medicine. It doesn't work against inflammation like pain in joints. But for pain and headache, sometimes it's a very good medication that you can use. If you use too much Tylenol, it can cause some liver disease. If you're using more alcohol than you should and you use Tylenol, it makes it a greater chance where you'll have serious liver disease. If you get liver disease, your eyes can turn yellow, your skin can itch, your skin turns yellow, your urine turns Coca-Cola colored. Be careful with Tylenol. Look at all the different medicines. Look for acetaminophen. Don't overuse it. Next is the NSAIDs. We've got aspirin and we've got ibuprofen. Let's talk about aspirin first. Aspirin's a great medicine. Not only does it work on pain, it works on inflammation. And so if you've got arthritis, aspirin is good for that. If you've got anything that's causing irritation of a joint, aspirin's very good. It works against inflammation, it works against pain. Side effects, it's really hard on the stomach. Some people can get GI bleeding with aspirin. Some people who are allergic that have nasal polyps and have asthma, they can have a severe allergy to aspirin. If you're younger than age 15, if you're a child, aspirin with fever, not a good medicine, or for pain, not a good medicine. There's a neurologic side effect called Reye's syndrome, so you stay away from aspirin if you're young. Then we get to the ibuprofen family. They're wonderful. They're good on pain. They're good against inflammation. They do a great job, but they also bother the stomach. So if you've got stomach problems, be very careful. If you use ibuprofen medicine and they work real good, be very careful about using them for too long a period of time. Because if you do, they begin to bother and damage the kidneys. You can get high blood pressure from overuse of ibuprofen or Aleve or that family of medicines. Talk to your pharmacist, talk to your doctor. If you're using those medicines more than you should, be sure that your doctor knows. There are two pills that have decongestants. That would be Sudafed, pseudoephedrine, or phenylephrine. They're both decongestants. And if you look at Claritin D, Allegra D, Zyrtec D, Tylenol sinus, Advil sinus cold, all of these have decongestants in them. And they're not totally safe. So let's talk about the dangers of decongestants. Now, the decongestant pseudoephedrine That means it's false ephedrine, and ephedrine is an adrenal type hormone, an amphetamine type medication, stimulates the central nervous system. But it does some things to the body. Number one, since it stimulates the central nervous system, it makes people where they have insomnia, they can't sleep well. So if you take Sudafed at bedtime, you may be looking at the ceiling all night. It may change personality. People may get irritated, agitated, emotionally labile, just because of a decongestant. Now, the decongestant in the nose takes the blood vessels in the nose and shrinks them down. If it does the same thing to blood vessels in the rest of the body, that's what would happen with high blood pressure. So if somebody has high blood pressure, taking a decongestant could theoretically raise that blood pressure a little bit more. So chronic usage of a decongestant can bother the blood pressure. It can bother our sleeping habits, our emotional stability. It quiets down the stomach. It tells people that they're not hungry, so some people could be losing their appetite. It causes the prostate sometimes to clamp down, and so the male urethra goes through the prostate gland. If it squeezes down, then you can't pass urine through there, and so we can get symptoms of prostate obstruction going on. So these medicines, these decongestants, can be dangerous. If you've got an irritable heart, it can cause arrhythmias. Bottom line, there's no free lunch on any medications. If you take medications, tell your doctor what you're taking, and especially if you find you're getting symptoms with that.
Now the issue of plaque in Ecuador, when phenylephrine is combined with acetaminophen, the blood levels of phenylephrine increase 4 times more than when the same amount of phenylephrine is used alone. Products that contains that combination of drugs include Tylenol sinus, Cidofate PE sinus, Benadryl allergy plus sinus, and Excedrin sinus headache. As a conclusion, we must be careful when buying drugs for the treatment of influenza because new drugs contain a combination of phenylephrine and acetaminophen that can produce an increased blood levels of phenylephrine 4 times more than when the same amount of phenylephrine is used alone, causing side effects as insomnia, headache, heart palpitations, anxiety, and retention of urine. Thank you so much for watching. I hope you like it and find it very informative.